Hi, I'm Elliot Klein. I'm the CEO of New York Psychotherapy. Welcome today to this very important community forum. We have a lot of distinguished guests today. We have Dr. Willard Ashley, who is our keynote speaker. We have Dr. Jonathan Kear, who's the Vice President and Chief Clinical Officer of New York Psychotherapy, Senator Gustavo Rivera, Senate member of the 33rd District, Councilwoman Vanessa Gibson, council member of the 16th District, our friend Assemblywoman Natalia Fernandez, Assembly member of the 80th District, and also candidate for Bronx Borough President, Senator Roxanna Prasad of the 19th District, and Reverend Dr. Patricia Seeley, who's the CEO of the Children's Haven. New York Psychotherapy, as you all know, runs child and family mental health centers in Brooklyn and in the Bronx. And over the past year, we've treated over 25,000 patients. During the course of the last 14 months, New York Psychotherapy has kept its doors open. We have never closed. We've been open the entire time, both in person and via telehealth. Most of our staff are bilingual. And we are hoping that telehealth will continue as a modality post-pandemic. It has been very useful, as we're going to be speaking about further during our forum. I don't want to use up the time because we have a lot of guests and a lot of things that they would like to say. So I turn it back to you, Anthony, and for our keynote speaker, Dr. Ashley.
Yeah, so without further ado, folks, we'll have Dr. Ashley go ahead and present. So take it away, Dr. Ashley.
Thank you. Thank you so much. I'm really grateful for the opportunity to be part of this conversation. It's one that's near and dear to my heart. I have family members who are just big fans of the work that you do. And so when you made the invitation, my family said, I don't care what you have on your calendar, figure it out, clear the calendar. You have to come and present, because they said that you have been such an instrumental part of the healing of the community, both in the Bronx and in Brooklyn. So here I am, and I'm glad to participate and glad to loan my support for what you do, and also in particular telemedicine, which I have utilized in my own private practice for the last, I guess, 14 months. And so I want to say a little bit more about that. I need to participate today because my mentor, the late Phyllis Harrison Ross, was a physician. At one point, she was medical director at Metropolitan Hospital. She served under 5 different governors in New York State as one of the commissioners of the Department of Corrections. And you may or may not remember her, but she was very instrumental in bringing telemedicine to the inmates across the state. And she fought long and hard to ensure that they had access in the prison system to telemedicine. So I have no choice but to be here this afternoon to have the conversation. And when we talk about the need for such services, I think as New Yorkers, and I'm a native New Yorker, born and raised in Harlem/Washington Heights, product of the New York City school system for good or for bad, and a graduate of FIT back in the day. And so it's important, I think, through the lens of understanding how the pandemic has impacted us in terms of mental health. I wear several hats. I'm a pastor for 38 years. I'm a licensed psychoanalyst in the state of New Jersey, and I'm a retired professor in the seminary, although I now teach at Rutgers University doctoral students in dealing with racialized trauma in their practice. And so one of the things I think is important to appreciate how the impact of telemedicine is that all of us have experienced the impact of this pandemic one way or another. It's either personal, professional, a public life, or political life. And in many cases, it's all 4 interacting at the same time. You recognize that this is, in fact, a global pandemic. We affirm that it's contextual, that not everyone is in the same place, and that some people are going to be okay, however you define okay, and some others will not be okay. And so it's important to have that as a starting point, if you will, and the recognition that BIPOC, Black, Indigenous people of color, are dying every day in ways that the quote unquote majority culture does not always fully appreciate nor understand. So I want to use that as a starting point, and that in the communities in which I serve, where there are people of color, that, and I will use the term we are screaming every day, help us stay alive. And there is a rap song of some years ago, and it's been repeated in other circles. When they asked the young person, "What do you want to be when you're 25?" and they said, "Alive." And the teacher responded, "There's no degree program for that." And the person responded, "Oh, yes, it is. It's called surviving the streets." And we add that now, it's also surviving COVID, surviving the violence, surviving systemic institutional racism in its many forms, and just trying to stay alive. So when we look at mental health, whether someone says it or not, what you do is essential. And mental health takes many forms. I argue with my professional colleagues that on every Sunday morning or every weekend, that I may be a licensed therapist, psychoanalyst, but as a pastor, I'm providing mental health. As an interfaith clergy person, every weekend, we are providing mental health. And I'm sure my colleagues will say the same thing. I tell folks, I go to therapy. I may be a therapist, but I go to therapy. And they go, "Thank God, because you're certified." Well, I say, "Yeah, okay, calm down." And I say, "Oh, but you're right. I mean, it's important that as the leader, that I try to normalize, particularly for Black and Latinx men, to normalize that there's nothing wrong with getting help outside of your normal channels, if you will. And I hold up the value of having a good therapist, having a good clinic setting where you can be properly evaluated, where you can have someone that understands you, that makes you do the work, but understands you, and helps you to sort out those issues. And even the support groups that I run for clergy, I strongly encourage my clergy colleagues, find a good therapist, because you need a place where you can talk about all that's going on. So sometimes I get pushed back. "Oh, I'm imam, reverend, doctor, rabbi, so and so, and I don't need a therapist." And I'll say, "Okay, I understand. Did you just go to therapy to talk about your crazy members?" And go, "Oh, okay." And they'll go sign up and say, "Okay," of course, in the process, they'll say, "Oh, by the way, Rev or Imam, how could you have handled that maybe a little differently? Well, how did your temperament impact the outcome?" And so all of us need therapy. In fact, when I took a summer course at Princeton Theological Seminary, Brian Kirkland had just retired, has the pastor of the Fifth Avenue Presbyterian Church. And he said to us very directly, as clergy or wannabe clergy, you need a mentor, you need a voice coach, and you need a therapist. So I strongly believe in the value of therapy. And again, given this pandemic, given what its impact, it impacts us personally. I don't think there's one of us that cannot say that we weren't anxious. If we didn't experience a loss personally, we were anxious. Did I wash my hands? Did I spray down the UPS box or the box from Amazon or whatever the case may be? Did I spray the mail down? Do I have enough wipes with me? Can I find alcohol wipes? And we became, at least 60%, 75%. What's the magic number that makes it right? And so we had anxiety on a personal level. We were concerned about our family members. And then you take it a step further to the professional level. We were worried about, do I go to work? Do I not go to work? Do I have the kind of job where I don't have to ride the New York City subway every day? And some people didn't have that choice. And so it built and added on top of their anxiety. And so you look at it personal, look at it professional. And then there was the public side in terms of, can I go outside? If I go outside, what's going to happen to me? Can bad things happen just by walking around the neighborhood as a result of the pandemic and all the other things happening? And then there's the political piece. And I'm not bashing the left, the right, the blue, the red, or the purple, but it's been exhausting And whatever your talking head person may be at 9 o'clock or 10 o'clock, it has just been exhausting listening to the arguments pro and con, and we're doing better, we're not doing better, take the vaccine, don't take the vaccine, and the debates and the fights around that. So, of course, we're exhausted. And again, my mentor, Dr. Phyllis Harrison Ross, used this phrase that I use all the time. I do footnote her, and she would say, as a psychiatrist, that there's nothing wrong with you, which is revolutionary to hear that from a mental health person, comma, what has happened to you is wrong, and let's talk about it. And so I want to affirm the work that's being done with this institution. I want to affirm the work that you're doing, and thank God for places like this where people can say, you know what, you're right. You don't have to pathologize me. No, you have to pathologize me to get paid. I got that. But beyond that, I'm a whole person, and I've gone through some things. I've experienced some things, and in a compassionate, caring way, can I talk about those experiences without shame, without blame and judgment, without trying to fit me into a box, but to say, this is who I am, good, bad, and different. This is who I am. And these are the struggles that I'm having in life, in my profession, in my world. Talk to me about it. And I was blessed last night. I was in the process of getting some furniture for my office. And the salesperson was telling me, oh my God, something about you. I'm in my jeans and t-shirt. She said, something about you said you must be a psychoanalyst or therapist or somebody. So I'm like, okay, I must have a thing on my forehead, psychoanalyst, right? But anyway, she said that I was going through a difficult period in my life, and I found this wonderful therapist. And I love the work that people like you do because it changed my life. She said, I held on to anger for decades until I finally went to get some help and had the right person, and it was life-giving. That's why we do the work that we do, because it's life-giving. And I'll stop right there because I'm a Black Baptist preacher, and I could go on and on and on and on. So
Thank you, Dr. Ashley. And now we can turn it over to our moderator, Dr. Kear.
Hi, thank you everyone for being here. My name is Jonathan Kear. I'm the Chief Clinical Officer of NYPCC. We really appreciate your support here. We have quite a number of speakers, so I'm going to make this very short. 14 months ago, when the pandemic started, we were forced to move to telehealth very quickly. At that time, we had little understanding of the technologies and the complexities that came with using telehealth as a platform to deliver mental health services. Very quickly, we adapted to the challenges, and we became experts in the use of telephonic and video-based psychotherapy and assessment. We have found that during the pandemic, the need for treatment has increased tremendously. The severity at which patients are coming, the level of complexity of their psychiatric conditions is more than we have ever seen. Patients are suffering in the community. At the same time, we have found that the use of telephonic and video sessions has allowed us to connect with patients in ways that we never have before. We have actually seen our no-show rates decrease, and telephonic sessions in particular has opened up access to mental health services in our communities. We have found that this modality is useful for all ages, even young children, although some of them may struggle with it. But we have found that we can assess who benefits and who doesn't. And we have opened our doors to more people than ever before. I've been very encouraged to see that CMS recently approved the use of telephonic services to continue. And we're quite hopeful that this will become, I guess, the law of New York. You know, we have a number of politicians here who are working to make that happen. I think at the same time, it's important to recognize that rate parity for telephonic, video, and in-person sessions should be the way things go. We cannot lessen telephonic services. They allow us to connect with some socio disadvantaged groups in our community. That's where we focus on at NYPCC. We work to bring mental health services to those who struggle and who can't readily find help. We are there as really a network for our communities. So I am encouraged that things are beginning to look up, but I am also weary of sort of leading the way and saying things are going to get better, because I know that for much of the population that we work with, things will continue to be hard. As people go back to work, we are going to find that some people are not able to return. Some people's anxiety conditions and depression will become more pronounced post-pandemic than it was during. We will continue to serve our communities and work with them. We will continue to work with our partners and continue to work with the politicians to make sure that our underserved population has all the resources and all the available treatments that they are entitled to and that we should provide. So having said that, is Gustavo Rivera here?
I haven't flagged him down, so he's not in yet.
Okay, so we will bypass that and we will move on to Senator Roxanna Prasad from the 19th District. Senator Prasad has been very instrumental in helping her community and helping the constituents of the state of New York. So, Senator Prasad.
Yes.
Hello, good afternoon. My name is Eileen Grant, and I'm here representing Senator Roxanna Prasad. As you know, Senator Prasad is chair of the Senate Social Services Committee and also represents the 19th Senate District, which is home to many neighborhoods and communities that bore some of the hardest impacts brought on by the COVID-19 pandemic. A few years back, we started hearing the word intersectionality used much more widely. This pandemic has certainly illustrated that poverty and mental health intersect, as do poverty and race and public health outcomes, poverty and public safety, poverty and justice, economic security and mental health, access to public health and likelihood of experiencing trauma. I do not want to reinforce the negatives of the pandemic, but I would be remiss if I didn't mention that many seniors have experienced a failure to thrive. We've seen that aging in place and sheltering in place are not compatible. People living with chronic health issues and disabilities have experienced tremendous difficulty in accessing care and support at a level that they have been accustomed to. Young people have lost parents, grandparents, or other members of the family that were living in their homes, and they've had to stay home away from their educational communities and other supports. Food lines grew in Brooklyn and Buffalo alike. Hundreds of thousands of New Yorkers felt economic despair for the first time, and economic insecurity and food insecurity are equally scary. Our healthcare and frontline workers have endured extremely difficult working conditions to ensure our neighbors remain as safe and healthy as possible. Many have put public health and safety before personal health and safety. Senator Prasad and colleagues, to mention Senator Rivera, have addressed many issues that intersect with and promote mental health. This year's state budget paved the way to full and fair public school funding, which has allowed New York City Department of Education to make bold investments in student mental, social, and emotional health. Education is the great equalizer. The budget continues funding and support for numerous food security programs like Nourish New York, and this is especially helpful given that the federal Farm to Families food box program has recently ended. Community anti-hunger organizations like City Harvest, the Campaign Against Hunger, and Food Bank New York City have selflessly delivered hope one box at a time. Senator Prasad and colleagues have fought to ensure that our community health centers didn't lose tens of millions, much needed Medicaid funding when our communities have needed it the most. The summer youth employment programs provide 75,000 New York City youth with a meaningful work experience. Assistance from the state is available to tenants and homeowners alike. Thank you all for all that you do and your commitment to the work that lies ahead. Thank you so much.
Thank you so much for that. And we really thank the Senate for all the work that they've done for the New Yorkers and for all of our patients and staff. I would like to introduce Assembly Member Nathalia Fernandez, who is Assembly Member of the 80th District and who is also running for the, I guess, the Bronx right now. So welcome.
Thank you so much. Good afternoon, everyone. And thank you to all the professionals and those dedicated to making sure that we look at health holistically, physical, mental, emotional, all that. I'm on the Mental Health Committee in the State Assembly, and that is something I hold near and dear, is the one committee that I made sure that I was on because in my time working here in local government as a public servant, it's an area that many I've seen have found difficulty building the courage to address, speaking with their families, addressing it in their workplace. And overall, it's been something that we've seen needs more attention when we look at our borough and our city. So I'm grateful to this conversation, everyone here that has done the work and the advocacy to make sure that we're really pushing programs and services that do help our overall mental health. And it was mentioned here before how food insecurity can add to that, housing security, all these different things for survival and amenities do add to our level of comfort and security. How many times have you heard someone be paranoid constantly because they don't know if this is going to be the last month that, they can stay in their apartment? Or now with the pandemic, just the fear of feeding your families. It really has added to the stress and trauma that many have been living with, but also now in fear of how to continue the days. So I too have been helpful with a lot of the legislation that we discussed here, especially expanding telehealth and making sure that we have constant food resources in our communities with Nourish New York. And those have been certainly a help to our communities, but we really need to make sure that in the long run, families don't ever get to these points that, they don't know when food's coming. They don't know when this, housing might be an issue. So for the Bronx as a whole, we've been in a hole, so we're trying to get out of it. But it is something that needs to be a constant conversation in all areas of our lives, looking at our children in schools. I've been grateful to work with NYPCC numerous times talking about the support that our children need, especially our young adults, our teens, knowing that that's a difficult time in their life. Personally, them coming to, their whether it's puberty or not, but also, a new level of responsibility within their families, especially children of immigrants that many times take on a lot of the responsibilities of the household. So as our kids are going to go back to school, we just heard that school is going to be full-time back in buildings in the fall. We need to make sure our schools are ready to support the needs of our students emotionally and physically to continue their education and to kind of catch up on what a lot of us had missed in this last year. So conversations about making sure every school has a school nurse, expanding community-based health centers that do provide mental health services, dental services, physical services, all that. And also looking at our senior centers, and telehealth is tied into that for those that may still have a fear about leaving their homes. We need to contact them. We need to have this constant conversation and interaction with them, because a senior's mental health can dwindle if they're not interacting with people, if they're not doing the daily little activities that they were doing once before. So to get back into the swing of things, it's certainly going to be a group effort amongst all of us in our own communities and our own workplaces to make sure that we're pushing the conversation to really have the support needed. So know that I am in your corner always and forever for the sake of mental health and making sure that we have accessibility to mental health services, that our insurance providers cover it all, every insurance provider. And that's a bill that I'm actually introducing in the Assembly very soon to make sure that there is no more barriers for anyone looking to get the extra services that they need. But again, I thank everyone for your dedication to this field, to your compassion to our community, and to making sure that we are all taken care of. So thank you so much.
Thank you so much for that, and we thank you for your continued support. Next up is Council Member Vanessa Gibson.
She's not on.
She's not on?
Oh.
Okay, so let's move on to Reverend Dr. Patricia Seeley.
Good afternoon,
Hi.
and thank you for inviting me again. You know, as I listened to the discussion about telephonic mental health sessions, I was just really, really very glad that NYPCC was able to incorporate that in the services that you provide to people in our community. Many years ago, seems almost like a lifetime ago, my first profession was as a nurse, an oncology nurse in the VA healthcare system. And VA was light years ahead of the private sector in offering telehealth services to our veterans, especially our veterans in rural areas. They had such a difficult time getting into the cities, into the large urban hospitals, and many times just wouldn't go for their appointments because it was too challenging for them to get into the city. And this provided an essential service for our veterans. It made it easy for them to keep their appointments. They were able to develop such great relationships with their physicians. They took time, the physicians took time with them, getting to know them. And we were able to actually document that healthcare outcomes improved through our telehealth services. And initially, we were not sure that they would work very well for our patients who were needing psychiatric services. But once we began to roll those services out to those patients as well, we were very, very surprised at how effective telehealth was in helping to stabilize some of our patients and just support them in the ways that they needed to be supported. And on a personal level, I've had the opportunity in the last month to have 2 telehealth consultations. And I was real glad that I didn't have to get in my car and drive any place or pay for parking. I was very glad that my appointment was at a certain time and it happened at that time. I didn't have to sit and wait 15 minutes or half an hour. The appointment happened at the appointed time. And it was just a wonderful experience. And so I'm really very supportive of telehealth services for our patients across the healthcare spectrum. And I think that anything that we can do to make sure that this becomes permanent for our clients in the Mott Haven, in the South Bronx community, whatever we have to do, that needs to be done. And we need to make sure that the insurance companies are going to pay for them, just like they pay for in-person services.
Thank you very much for that. You know, over the last year, we've really noticed in NYPCC that also with telephonic services, patient satisfaction has also increased, right? We're finding that patients are satisfied with access by telephonic services. They're also satisfied with video services. One of the things that our patients have commented to us and our therapists have very much picked up on is that the ease of access of being able to pick up the phone and call their therapist has really been a benefit to the entire community. Patients used to struggle with attendance. And now, instead of having to struggle with the transit system, having to find childcare to come to sessions, patients are able to still be in their homes and access mental health services. And we have found that it has made a tremendous improvement in clients' lives. So I really thank you, everyone. We do have a couple of questions that came in that perhaps we can have the panelists discuss. So the first question relates to telehealth. As a result of the success of telehealth during the pandemic, the Office of Mental Health would like to see video and telephonic mental health services made permanent with rate parity to in-person, face-to-face sessions. What is your position on this? So I guess to Eileen Grant.
I'm sorry, just a second. Senator Prasad generally supports expanding and improving access to mental health services and resources. Senator typically defers to the respective committee chairs with regard to specific technical provisions of various bills. Our office will review bills 5505 and 6256. This is per my senator.
Thank you.
You're welcome.
You. And I guess the same question also to Assembly Member Nathalia Fernandez. I mean, do you support, I guess, the rate parity between telehealth and in-person sessions?
She might be, oh, there she goes.
Starting in I'm so sorry, was I called?
Yeah.
Yes.
My bad.
So
I had to jump onto assembly session.
Okay.
And,
we were
and
talking
listen on that one on my phone.
We were talking about the issue of rate parity between telephonic sessions and in-person sessions. We were wondering about your support for that.
Well, I think telephonically has been, very, in a way, soothing. I don't know if that's the word for it, but I've met many seniors and contacted and spoken to a few that still have concerns about, going to public places, being in public offices, all that. So I think that opportunity should be given, especially those that may have disabilities and, struggling to travel. So I think it should start both ways, continue both ways. Mm-hmm. For those that, are ready and willing and able to leave their homes and to get to an office, or for those that do have difficulty and could utilize the help right here in front of them from their home.
Thank you. Thank you. Also, having witnessed the devastating mental health impact due to the pandemic, what are some of the legislative initiatives that are being pursued to increase access to mental health treatment?
Well, I mentioned making sure that insurance companies do accept mental health treatments in their policy platforms, but also just having it available as, I don't want to say as free as possible, but bringing samples of these services to our public places. Like I know in my community centers, they've had numerous conversations and guest speakers to talk about, mental health and signs of different ailments that maybe people don't feel. Like, now we know that depression has increased, but there's still some people that are denying that they are suffering from depression. So having these conversations to help recognize the signs of it can push someone to then go get real help for it. And just also, having the awareness of what is already available in your communities. Like right here in my district, when I first entered in the assembly, I was able to secure $500,000 to expand a mental health clinic right out of Jacoby Hospital. And this clinic does accept those that are uninsured with a small copay of as low as $5. So those are services that many people should know of in case your current healthcare provider doesn't support that, or you don't have coverage. As well as having these conversations with our school administrators. I also introduced a bill that would expand training to teachers and staff in buildings and the schools to see the signs amongst young people of depression, anxiety, anything else. So then the teacher can be a referral to the guidance counselor, to the doctor, to see, what more support the student needs. And that was something that I took part in before I ran for office, or actually ever started working for office, because I was a volunteer counselor at Life is Precious. And this was a program that was referred to parents by the guidance counselor when they recognized some signs of depression or self-harm, maybe suicidal thoughts amongst young women, and particularly daughters of immigrants and young women of color. Because sadly, statistics show that it is young women of color, Latinas mainly, that have the highest rates of self-harm and suicide. So making sure that we provide programs too that are culturally sensitive to different lifestyles, to different pressures amongst, home and society and community, that can add to or have added to the mental stress of our young people. And that's something that I pushed for in the state assembly, to make sure programs like Community Life are supported, because they deliberately hire counselors and are trying to expand amongst, Muslim families and African families, to help the young people there really be able to address the stresses in their life. Because again, there are differences amongst different families of different socioeconomic statuses, and also geographical, concerns, where they live, what's the status of their neighborhood, that can add to a lot of these stresses. So we need to make sure that the professionals that we have are addressing this and are able to work with the family and the young person to help really take care of the ailments that they're going through.
Thank you. I guess we can open up the questions to some of the questions in the chat. We had a question come up regarding having an alternative emergency number, I guess, for mental health emergencies. I guess moving it away from a police response for mental health emergencies, and rather perhaps sending social workers. I was wondering if any of the speakers wanted to comment on that or discuss that.
Yes, I will say that we just passed a bill through the Mental Health Committee yesterday, establishing a 3-digit emergency number for those that are going through a mental health episode, or feeling suicidal, or just needs to talk. There is a suicide hotline, but that's a 7-digit number that even I can't remember off the top of my head, as much as I try to promote it. So as much as we jump to 911 for certain emergencies, when we're having a mental health emergency, there should be a whole nother entity, because like the conversation goes with how to address a lot of the concerns and crises here in New York City, police are not the answer for everything. So why are we calling 911 to send a police officer that may not know how to handle the situation? We need to have a separate avenue for mental health crises and services and immediate help for those that need it. So I believe the number will be 877. So forgive me if I have the wrong number in my head, but I know it's an 8, and it's a 3-digit number that will be the emergency hotline for suicide crises and mental health concerns.
Wow,
so hopefully
thank you.
That passes. Yeah. We got to get that to the floor. It passed out of committee. It should come to the floor before the end of session. And I see no reason Governor Cuomo wouldn't sign it. So that's certainly
Willard actually also wanted to comment.
Yeah, in both Pennsylvania and Florida and the state of New Jersey, they've already begun to implement such a program. As I said, I teach at Rutgers University, a school of social work. I've already beginning to have the conversation with doctoral students of social work. And on Southern New Jersey, they've already begun riding with the police. They have proper identification that identifies them as social workers, not patrol people. And in my conversations with prosecutors and police captains in the state of New Jersey, they said about 1/3 of their calls are really mental health related. And so it's tremendous help to be able to say, you know, this is social work versus law enforcement type work. And that's important. And I fight all the time with people in New York and New Jersey and across the United States. They pick up the phone to call 911 when it's really not appropriate. When I was at staff therapist at Riverside Church, oftentimes bike pipe, oh, I called the police. Like, no, don't do that, because your 6'5", 300-pound kid doesn't scare me. Mm-hmm. Like, dude, I'm from Harlem. I'll knock you out. So back off. Police show up. It may end a lot differently. And so I try to say, you know, if I get it, they're acting out, they're being violent right now. They're de-escalate, get them to a psychiatric spot or clinic, but not 911.
Yeah, because unfortunately, you know, I think we've gotten to a place in some cases where the presence of an officer can escalate a situation without them even doing anything. So if that's what's happening, then let's try something else. You know, like it's the same, as the saying goes, doing the same thing over and over again and expecting changes is not going to make change. Like, we have to really be bold and create a new entity that will address these concerns, that will de-escalate properly, and that will keep people safe and bring them to a safer place, mentally or not.
Thank you so much. Yeah, thank you so much. I guess if I can call on Lori Cole, I believe Lori had a question or a comment.
Hi, everybody. This is Lori. I'm the executive director of the New York State Council for Community Behavioral Health Care. We're a membership association in Albany, representing about 105 mental health and substance abuse providers around the state. Thank you for including me today. I just wanted to say hello to the Assemblywoman and let you know that from my perch here in Albany right now, it looks as if in the Assembly, the telehealth rate parity bill is not going to go. The Senate has it ready for a vote, whereas in the Assembly, there appear to be remaining questions, particularly in the Assembly Insurance Committee. And so I wanted to make a commitment to you, Assemblywoman, that we'd like to share information with you that sort of debunks some of the issues that we're hearing being reported from certain Assembly people around their misgivings around telehealth. The reality is, at the end of the day, that if providers are not paid on par with face-to-face care for telehealth services, they will not be able to continue to offer it. And the costs are real. The costs are the same, if not more. But there seems to be this mythology in certain sections of the legislature that are sort of still really concerned about some of the issues around telehealth. And we've been collecting articles and information that sort of takes on those issues. I'd like to make a commitment to share that information with you and wonder aloud whether you have any thoughts about what's happening in the Assembly with the telehealth bill.
Well, I'm not in the insurance committee group, so I was not aware that there is these questions, but
I think we really need a champion. I think that one of the things that we need is folks like yourself who are caring about the individuals who are underserved, unserved, communities of color, communities who have benefited, I think, a great deal from access to care in the way in which they need it, without having to spend money for transportation, without having to cut out of work if there's, if there's an appointment during the day in order to be able to get there. There's a million reasons why telehealth has the potential ability to address healthcare disparities that have been long plaguing the healthcare system. And we really need to work hard to debunk some of the mythology that is causing lawmakers to have concerns that I believe are unfounded with regards to telehealth. So my commitment to you, and I think all of us can commit to you to share resources with you so you can be that champion for us, one of those champions for us.
As a mental health advocate in the chat, so everybody watching
I will do that.
Contact me now. Please give me these resources.
I will.
I do have
I
to make a
will.
slew of calls to some of the committee members just for other last minute bills, but I'll
Okay.
reach out to the insurance committee chair too. It's interesting how different but alike the houses can be, Senate and the Assembly. And granted, there's more members, so we got to go through more people to approve and get their okay. But it's always been like, we don't know what's going to happen in the Senate. So now it's like, okay, the Senate's moving. Why are we not moving?
Exactly. It
Yeah.
switches from year to year, and there's a pendulum effect to it. But, on this issue, there really can be no, none of that back and forth on such an important issue. And we really need to just address the contentions and the problems that people think they have with telehealth and audio only.
And that's another thing that adds to just ease. Like, we think of the worst sometimes, like, oh my God, I could be suffering this. Maybe I should do this. Maybe I should do that. Like, and that adds to anxiety for those that don't know. Like,
Right.
I discovered that I was having not an anxiety attack, but early on COVID, when it first started, nobody knew anything. Like, for the first time, I started feeling some chest pain.
Yep.
So I thought I had COVID. And this is when, everyone was calling the hotlines. Like, what's the symptoms? Do I have it? Should I get checked? All that. And twice, the doctor's on the line, and my own doctor was like, you don't have COVID because, you're not with no lack of smell, this, but that could be anxiety. So
Yep.
I'm like, so my chest is hurting because I'm nervous. Like, I had to understand it at first. But yeah, that was like a real physical experience that I felt, not knowing anything. So just having that assurance of having a conversation and, at least getting some direction or some idea as to what is the source, what is the solution, can really be the help that someone needs,
Access is everything.
Indeed. But yes, send me that bill number.
Absolutely. Will do.
Bill, and I'll definitely do my outreach.
Thank you for your work.
Of course. Thank you. Thank you for your work.
Sure.
Thank you. Thank you so much. Access really is important. And in that regard, I wanted to remind everyone that NYPCC continues to be open 7 days a week. We provide services from early in the morning till late at night. And if you have any referrals, they can reach right out to us at our numbers or by email or on our website. We want to make ourselves as open and as available to the communities as possible. In that regard, I really would like to thank everyone who participated in today's meeting. I think it was very informative. And, as an agency, we will continue to push forward to providing telehealth to the community, because we have found that it is a critical service that we provide, and that our recipients, our patients, their families are really benefiting from this. So I, again, thank you everyone for being here today.
Yes.
Thank you.
Everyone.
Thank you so much.
Have a good afternoon.
Thank you.
Great afternoon.
Bye.
Happy Memorial Day
Bye.
weekend. Enjoy the beautiful weekend to come.
Yes.
All right.
And if you like what you heard today, please, it will mean the world for us if you can just please follow us on Facebook, Instagram, Twitter, YouTube, write us a review on Google, because honestly, this type of forums will help out so many people who are seeking mental health services. So thank you all again for coming, and thank you for being with us today.